Good morning, everybody. 11:15 in the morning. Bang on. I love it when we're just right on time. This is Health on Tracks, and you're with me, Anil, on the mic. It is a beautiful Monday morning, and it is the holy month of Ramadan. Our Muslim brothers and sisters are all fasting. So we thought, we shall delve into a topic that concerns people who are also consuming medication while fasting at the same time. I'm sure you would have all of these questions lurking in your mind, like, can I still consume medication while I'm fasting? Will it affect my fasting, or will it, affect the efficacy of the medication that I'm consuming if I don't eat and I still, because doctors always say, mesti makan ya, jangan ambil ubat kalau tak makan. Makan dulu baru ambil ubat, right? We often hear that. And to shed some light on that, we have the very same person who tells us that when we're taking our drugs, our medicines over the counter. And she is Noor Nazira Begum Muhammad Taib. She's a pharmacist at Klinik Kesihatan Sentul. And today she's going to talk to us about fasting and also taking medication. Nazira, good morning.
Good morning. Thank you for having me today.
Pleasure is ours. Welcome to TRAXX.
Thank you.
Ramadan Kareem to you.
Yes, thank you so much.
How has Ramadan been thus far?
So far it's quite challenging because I'm breastfeeding, but so far so good.
Okay. Is it a boy or a girl?
Two good. I have two boys.
Oh, wow. Congratulations. So, okay, before we start our conversation today, which is a rather interesting one, and I'm sure lots of our listeners are intrigued to find out more about this, briefly tell us about yourself.
Okay, I'm a pharmacist, working in 10 years experience. Currently, I'm working in Klinik Kesihatan Sentul.
Right.
And that is generally about my experience so far.
So 10 years of experience working as a pharmacist. I'm sure you would have had your fair share of experiences dealing with people and so on. You're going to share with us about that.
Yeah, sure.
Yeah, so let's, shine the spotlight on our Muslim listeners who are fasting at this point of time and who are also undergoing medical treatment. So let us know if they can still fast while taking medication.
Okay. Bismillahirrahmanirrahim. Assalamualaikum and good afternoon to everyone, especially to the listeners of TRAXXfm. So first of all, thank you again for inviting me. And back to the question, can Muslim patients who undergo a medical treatment fast? So firstly, I will explain in Islamic perspectives. So as we know, fasting is the third pillar in Islam. In fact, in the month of Ramadan itself, it is mandatory for a healthy adult Muslim to fast as commanded by Allah in the second chapter of Quran. Nonetheless, there are Muslims who are unable to fast for whatever reasons, and for that, we have what we call as rukhsah, which is the leniency given to these Muslims who are unable to perform any of the commitments.
So, sorry, you meant rukhsah?
Yes, rukhsah. Yeah.
Okay.
So it's one of leniency given. So if you're unable to fast, then you're exempted from it. It's okay, you can break your fast. However, it is your responsibility to make up for it at some other time. So how do you make up for it is either what we call as qada puasa. Qada puasa means make up for the missed fast in the following month, or you can also pay fidya, which is a type of donation given to the poor or needy. That said, can a Muslim patient who have a chronic disease fast? The answer is yes, they can. Actually, it's possible for them to fast safely. Okay, however, it is also encouraged if they do intended to fast, they talk to the doctors about it so that the healthcare professional, the doctors, the pharmacists can do something, can help by managing their medications as well as their conditions. So please, all the listeners there, do not discontinue your medication under the guise of fasting without first telling your doctors, because unfortunately the disease didn't take a break during Ramadan, right? So you're still sick, and if you do not take your medication, it will lead to serious complications. So if you are not sure on how to take your medications during fasting, you can seek help from pharmacists, from various facilities, even hospital, clinic, community pharmacy out there. We are always there to help you.
Okay. Thank you very much for shedding light from an Islamic perspective, on how our Muslim listeners can excuse themselves when it comes to fasting and taking medication. Now, what are some of the medical conditions out there that would exempt a patient from fasting?
Okay, that a good question. So there are few situations that will exempt a person from fasting. So the first one, for example, if the person is sick or the person is ill or the patient is in severe pain or serious discomfort, so much so that fasting will just increase his pain or slow down the recovery, then the person is permitted to break his fast. But remember, again, as what I said before, it is obligatory to make up for it. Okay, once he is healthy. Second medical condition, for example, if the person is unable to recover from a terminal disease, like for example, that patient have is a end-stage renal cancer patient, end-stage cancer patient, or bedridden stroke patient. So in this case, for the fasting days that are missed, fidyah must be paid to the poor or needy. They are not required to make up for the missed fast, as the payment of fidyah itself is sufficient. So the third medical conditions that allow patient to be excused from fasting is the pregnant lady and as well as nursing mother. So for these two categories, there's two concerns. So the first one, if, for example, the pregnant lady or the nursing mother is worried about the fasting will harm herself, then it's permitted for them to break the fast. Okay, but again, she must make up for the missed fast, means she have to do qada puasa. The second concern, if for example the pregnant lady might be like scared, okay, fasting might raise my baby, or the nursing mother scared or a bit afraid that it will cause the low milk productions or will affect the baby health, then it is also permitted to break fast, but in this concern, they have to do two things, okay, which is they have to do qada puasa as well as they have to pay for fidyah. So it's based on it's based on their concern.
Right, okay. And I also understand that different forms of medication affects fasting differently. So are there any medications that actually don't break anyone's fast? Is there what kinds of medicine that doesn't break the fast?
Okay. So thank you so much. This is the most common question that we usually receive. For example, me as a pharmacist in a counter, some patient will ask me, is this medication will invalidate my fast? If it is not, so the issue of taking medicines actually during the fasting month have been extensively debated by religious experts, and there are divergent opinions. So, but for us, luckily we have JAKIM. So JAKIM actually have published a fasting guideline for patients in 2013 that categorized varieties of medicines that will invalidate fast and vice versa. So for example of medication that will invalidate your fast, in a simple words to understand, batal puasa. Okay, so these are the one. Okay, for example, the most obvious one is oral medication. So any oral medication that you take orally, tablet form, capsule form, liquid form. Okay, suddenly during the day you have a cough and then you take the cough mixture. So of course it will invalidate your fast.
Right.
Okay, secondly is any medication that's inserted in your vagina. So we do have medication like that. You know, for example, we have pastries, vagina tablet. So it will invalidate your fast. Okay, and then we also have medication that is inserted in the anus. For example, enema, suppositories. So it will as well invalidate your fast, as well as general anesthesia that involve gas. So all of these medication, to be easier to remember, will batal puasa. Okay. On the flip side, okay, if for example I already list down all the one that will invalidate fast. Of course, you want to know that what are the medications or procedure that will not invalidate your fast, right? So for medications or procedure that will not invalidate fast is, for example, your eye drops. Okay, anything you put in your eye drops, okay, your ear drops.
So anything topical, basically.
Yes, topical. Okay, it can be eye drops, ear drops, nasal drops. Okay, as long as in your nasal cavity, nasal spray, mouthwash. Okay, mouthwash as long as you gargle and you spit it out.
Spit it out.
If you swallow it, it's a different concern. Okay?
Don't know if I'll survive that.
Don't blame on me. Okay, another topical medication like cream, ointment, patches. Okay, we have like, for example, for patients who want to quit smoking, for example, they have a patches for them. It's called a nicotine patch, so it will not invalidate your fast. Okay, any form of injectable that is administered your blood vessels, skin, joint, muscles will also not invalidate your fast. So the most common relevant example here is the COVID vaccine. Okay, so if you are planning to take COVID vaccine or any type of vaccine during the month of Ramadan, please do remember it will not invalidate your fast. Okay, so another example is your sublingual tablet. So there is a word tablet there, might cause confusion for some of the listeners. So sublingual tablet actually is a tablet that you just put under your tongue. Okay, you are not swallowing it. So yeah, there are medication like that. Okay, and they are commonly prescribed for patients who just had heart attack. Okay, so that the medication can help to alleviate the chest pain and as well as angina pain. So and as well local anesthesia or partial anesthesia, because it's either injectable or spray form, so it will not invalidate your fast. So another one that I would like to highlight here is inhaler. Okay, so inhaler is a bit tricky. Okay, why I say so is because there is two different opinion. For inhaler, okay, for example, all the listeners are not so familiar. What is inhaler actually? So inhaler, if you are not familiar, is a type of device. So this device actually deliver your medications through your mouth into your lung.
That's for people who are asthmatics and have lung
Yes,
conditions.
correct. So if you are breathe in, okay, means you are breathing through your mouth to put all the medication into your lung. So that is why it becomes tricky there. Okay, so the first opinion says that it will invalidate your fast because taking consideration that the component might enter the stomach through mouth, and the second opinion says it will not invalidate your fast, saying that single inhaler only contain a few drops of water and it quite comparable to gargling.
I see.
So secondly, when we use inhaler, usually during the daytime, it is emergency situation. We have shortness of breath, asthmatic attack. So that is when we use inhaler, right?
Okay, so just to interrupt you there, so you covered on most of the medications that would invalidate our fasting, and we ended with inhaler. Hold that thought. We'll jump in for a quick break, Nazira, and then when we come back, we shall resume with our discussion today on fasting and medicine. Today on Health on TRAXX, Anil on the mic is speaking to a pharmacist from Klinik Kesihatan Sentul. Her name is Noor, Nazira, Begum, Taib, and our topic today is on fasting and medicines. Don't go anywhere. Health on TRAXX. We'll be right back. Welcome back to Health on Tracks with me, Anil on the mic. This is TRAXX Momentum, and as usual in the second hour of our shows from Mondays to Thursdays, we bring you very interesting topics for us to talk about, and today we're talking about fasting and taking medication at the same time. And shedding some light on this, I have in the studios Noor, Nazira, Begum, Taib. She's a pharmacist from Klinik Kesihatan at Sentul, Kuala Lumpur. Nazira, welcome back to Health on Tracks.
Thank you.
So now let's jump into the frequency of taking medication. I was told that, you as a pharmacist, patients often ask you about how they can manage the medication sporadically. So depending on the type of medication they have to consume, it's either once a day, twice, thrice, 4 times. You can just go on depending on the severity or the frequency that they consume that. So talk to us about that. How frequent should it be taken?
Okay. So what we need to understand here, just because you are ill, fasting do not prevent or stop you from receiving treatment. Okay, so it is really important that if you are ill, you have a chronic condition, you are on a regular medication. For example, you have diabetes, you have hypertension, you are also an asthma patient. So you have to continue to take your medications. So because if you do not take it, there is a risk of complication that might occur that might lead to hospitalization. Okay, that is what we don't want to. So if there is anything that you are not sure as a patient, don't be scared to approach any of the healthcare professional, doctors, pharmacists, so that we can help you with that. However, there is a general guideline on how to take your medication according to the timing. Okay, so for example, it is once a day, I guess. It's pretty simple. Anil, you want to guess? If it is once a day, when should you take it? Want to guess?
I would assume probably in the morning, right after your breakfast maybe.
Okay, if it is during fasting?
During fasting, right after sahur?
Yes, correct. So it is once a day. It's pretty straightforward.
Yeah.
Okay, you can either choose is after sahur or after berbuka. It is after meal. That if it is before, is once a day and it is before meal, then you can take before sahur. Okay, so it's pretty simple. Okay, and then how about 2 times a day? Okay, for example, if the medication need to be taken 2 times in a day, it's also pretty straightforward. Okay, 1 dose, the first dose you can take during the sahur time, and the second dose you can take during the berbuka time. Okay, if it is after meal, a medication that need to be taken 2 times a day after meal, I will go a bit slow on this part because I want the listener to understand really clearly. Okay, so if it is 2 times a day after meal, for example, the most common example, we have a diabetic medication. So the diabetic medication, metformin, for example, you need to take 2 times a day, for example, after meal. So the first dose you take after sahur, and then a second dose is after berbuka. Okay, that one is 2 times a day for after meal medicine. How about the before meal? For example, that medication need to be taken before meal, but 2 times. Okay, so the first dose you need to take before sahur, which is 30 minutes before sahur. Okay, and then for the second dose, we will see before berbuka. So it sounds a bit weird, but this is what usually we will advise our patient is that when it is you break the fast, you break with a glass of water or sweet drink just to ensure that you don't have any low blood sugar, and then you take your medications. Okay, then after that 30 minutes, only you take your first meal. So you have to wait. But certain patient, okay, they are like really, really hungry. Okay, some of it say, Nazira, I cannot wait lah. Then how? Okay, so if you can't wait, then it's okay. You can take your first meal. You can berbuka first, okay? Don't worry. But you have to wait for another 2 hours after that. Okay? If the medication need to be taken in empty stomach. Okay? If it is after it is after meal, then you can straight away lah. After berbuka, you can just take the medicine. Okay, so how about 3 times in a day? We do have medication that need to be taken 3 times in a day. So please, 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 especially to all the listeners, do not skip. Okay, for example, like, today, now is a fasting month, so I want to skip lah. Okay, I want to take 2 times only. Okay, no. If it is 3 times in a day, the first dose you take during sahur, second dose during berbuka, and the third dose is before bedtime. Okay, clear? Okay, how about 4 times? Sounds more complicated. So for 4 times medicines, okay, we do have also medications that need to be taken 4 times in a day and depends on the disease. For example, last week, I had a patient that have this very serious infected wound, and she was prescribed, and she also is a diabetic patient. So she was prescribed with antibiotic, and this antibiotic need to be taken 4 times in a day. So in these cases, usually we will ask back to the doctors and ask for their opinion. So the doctor usually, in this case, if it is so severe, patient have a severe wound and so on, they are usually advised not to fast. Okay,
Right.
or maybe doctor have any other alternative, then they will might switch lah to any medication that maybe 2 times a day or 3 times a day.
Okay. I think what I can conclude by this explanation that you gave is that medication management, management of consuming your medication is very important, especially during the month of Ramadan.
Yes.
And I think our listeners who are, who are regularly visiting the local health clinics, they can get advice from the pharmacist, because I'm pretty sure that everyone else who are in your in your unit will be as equally as informed as you are. Now still touching on consuming medication, its frequency and so on, and the management of consuming medication during the month of Ramadan, I want to touch on the people who are suffering from diabetes. What is the, regimen that you think they should follow so that they can manage their condition well while they're fasting or not at the same time?
Okay, so for diabetic patients, actually it is possible for them to fast safely.
Right.
Okay, so again, I would like to repeat this over and over again. If you do intended to fast, you first need to talk to your doctor. Okay, about it. Okay, if a person with diabetes inform the doctors that they do want to fast, so what will doctor do is that they will do a complete checkup to see whether you are fit or not to fast.
Fit to fast or not?
Yes. Secondly is that they will also talk about the potential risk of complication that might occur with fasting, because when fasting you might also have some low blood sugar, high blood sugar while you are fasting. So they will talk about it, and also they will teach you on how to identify. This is the important thing. You need to identify it. Okay, so to identify the signs and symptoms of low as well as high blood sugar. So, for example, like during 5 p.m., I'm fasting today, for example, and suddenly I feel dizzy, I'm feeling sweating, cold sweat, I want to faint, okay? So it might one of the signs and symptoms that I'm having a low blood sugar, which is in the medical terms, we commonly refer to hypoglycemia. Okay, and then for high blood sugar, the signs and symptoms, for example, where you have a frequent thirst and urination. So you as a patient, you must able to identify these signs and symptoms and ready. This is the keyword, ready to break your fast if needed. Okay, so the doctor as well will help to refer you to the dietitians, the diabetic educators. So usually they will help you to plan with a healthy menu or healthy diet during the month of Ramadan. And lastly, they will also refer you to the pharmacist. So the pharmacist role here is that they will help you in terms of modifying your timing, as well as some of the certain diabetic patients, they have insulin as well, right? So this insulin, they will help you to modify the timing and as well as insulin dosage. So for example, okay, we have insulin that need to be injected 3 times in a day in a normal day. So for example, during fasting month, so they need to inject 2 times a day. Okay, the first one is before sahur, 30 minutes before sahur, and the second dose is that before berbuka. Okay, as I mentioned before, you can have 1 to 2 pieces of kurma, inject your insulin, go for a Maghrib prayers, and come back to have your first main meal.
Still touching on diabetes, I have, heard and read of mothers who are pregnant, having a sudden spike in their sugar levels as well. And that's pretty common, especially for mothers who are pregnant. So how should they be tackling this situation during the month of Ramadan, Nazira?
Okay, so now you're referring to a pregnant lady, right? So a pregnant lady, as I mentioned before, you must able to identify signs and symptoms. Okay, and as I say before as well, you must able to identify and break as fast as you know. For example, you already feel hypo, then you have to break your fast. You have no options.
Okay. So you just look for the telltale signs and then just go for it when you think it's important. All right, let's jump in for another quick break. Today on Health on TRAXX, I'm speaking to Noor Nazira Begum Taib. She's a pharmacist at Klinik Kesihatan Sentul, Kuala Lumpur. And she's been talking to us about fasting and also taking medication at the same time. Health on TRAXX will be right back after a short break. Don't go anywhere. With me, Anil, on the mic today on a show that I've given an acronym. It's the HOT Show, H-O-T, the first three letters that comes on Health on Tracks. We're talking about fasting and medicines, and to help us with that, we've invited to the studios Noor Nazira Begum Mohammad Taib. She's a pharmacist at Klinik Kesihatan Sentul, and Nazira has been shedding some light, and she's been teaching us on a lot of things, and it's been a very enlightening conversation. And I think, Nazira, another important thing that you mentioned that I think all of us should take note of is to never assume what we are capable of doing. Always seek medical treatment. Go to the experts. There's a reason why they're experts. People like you, doctors out there. Now, still touching on that, what are some of the precautions that people who are fasting should follow while they're taking medication?
Okay, so to summarize everything, fasting is actually beneficial for one health. However, especially those with chronic disease, it is essential to continue taking medicine with minor modifications and constant supervisions of healthcare professionals. So effective communication between patients and as well as healthcare professionals is really, really crucial to ensure intake of quality medicines while fasting. So some of the take-home message to all the listeners out there. First one is please comply with the doctor's prescribed appointment schedule. For example, during the month of Ramadan is your appointment. Please go. Okay, don't skip because this is a month of Ramadan. I want to stay at home. No, don't do that. Okay. So, secondly, consult doctor regarding any medicine adjustment during the month of Ramadan. Okay, don't be so secretive with the doctor. Okay, tell everything with the doctors. Ask your doctors, is it possible? Okay, can you help me with that? Okay, and please, 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 again, do not alter any of the dosage frequency by yourself. Or maybe I go to the Google everything, and then I do the medication by myself. Don't do that. Okay?
Don't self-prescribe.
Yes,
Never
don't do that. Okay, please. We are here to help you. Then you should ask for your help. Lah.
Yeah.
Okay, and then please obtain advice from pharmacists regarding medication. Schedule, organize a healthy menu as suggested by either dietitians and as well as diabetic educator. And lastly, this is very important, okay? Beware of your own health and prepare to break if necessary. Okay, I understand most of people, they want to fast. Okay, but if it is really in a critical situation, okay, your low blood sugar is already 5 o'clock, you cannot risk yourself to wait for another 2 hours.
Yeah.
Okay, so you have to break if necessary.
So health comes first.
Yes.
Right. Okay. Nazira, thank you very much for setting aside your time on this Monday morning, for coming here to TRAXX and talking to us about the topic that we're discussing today. Any final words before we let you go for the day?
Okay, so for all the advice already given today, for my last word, okay, any further inquiries regarding medicines, you can direct to the National Pharmacy Call Center, which is available Monday to Friday, 8 to 5. Do follow us on Kenali Ubat Anda, Facebook, Instagram, TikTok for latest update and info about medication. And lastly, this is personally for me. Happy Ramadan and stay healthy, everyone.
Thank you very much. So just to recap, you mentioned Kenali Ubat Anda. So that's the portal on social media.
Yes.
On Facebook, Instagram.
As well as TikTok.
So all our listeners have to do is to just look up Kenali Ubat Anda.
Yes.
And there is a hotline that you quoted as well.
Yes.
What is the
number, is it?
Yes, the number, yeah.
Okay. For the number of the hotline, hotline is 1-800
right.
88 6722.
6722.
So
all right.
that is the National Pharmacy Call Center.
So National Pharmacy Call Center, 1-800-886722. If you need any help and advice on taking your medication or for something that is a bit social savvy, go on to Kenali Ubat Anda. They're on Facebook, Instagram, and TikTok as well. Nazira, thank you very much. You have a lovely day. And once again, Ramadan Kareem to you.
Thank you so much.
All right, and that was a very interesting conversation that I just wrapped up with Noor Nazira Begum Mohammad Taib, a pharmacist from Klinik Kesihatan Sentul, and today she spoke to us about fasting and taking medication, and we understood that as long as we manage our consumption of our medication, we can still fulfill our duties as good Muslims by observing our fasting. But at the same time, Never ever assume things. There are always doctors and experts out there. So very simple. Dial up a number like 1-800-886-722 or visit your local health clinic for you to get all the advice you need. If you missed out on this conversation, worry not. You can catch the replay by visiting TRAXXfm official's Facebook page or even our YouTube channel. Time on the clock, 47 minutes past 11 in the morning. Coming up in 13 minutes, we'll be crossing over to the RTM Radio News Center for the 12 o'clock news bulletin. And then right after that, Anil on the mic will be seeing you for the third hour of TRAXX Momentum. The music continues. Great company continues right up to 2. Don't go anywhere. Stay tuned. Here's Iris, Go Go Dolls, TRAXXfm.